Let's see about the conduct of labor. So we have seen a small introduction about the conduct of normal labor in our previous video. In this video we are going to see about the proper conduct of labor. So for the conduct of labor, the first point is the management of first stage of labor. We will see how to manage each stage of labor. First is the first stage of labor, which is nothing but the onset of painful uterine contractions to full cervical dilation. So in this, first we should assess the progress of labor, and the two important parameters for the assessment of progress of labor are the cervical dilation and the descent of fetus. These two are the best parameters to decide the progress of labor. So during the first and second stage, the course of labor is monitored by plotting a partogram. Which we start to plot from the active stage. So now let's see about the partogram. So by plotting a partogram, we can detect a delay in labor at any stage and thereby to provide prompt treatment to avoid any complications. So as we have already seen, partogram is plotted from the active stage of the first stage of labor, that is after 4 centimeters of cervical dilation. As you can see, this is a picture of a partogram, and here we record many informations. Let's see them one by one. First is maternal information. These are all the maternal details, which include the name of the mother, her gravida, para, hospital number, date of admission, time of admission, and the time of rupture of membranes. So these are the maternal details. Now coming to the fetal details. We monitor the fetal heart rate every half an hour. So here each small box represents 30 minutes, that is half an hour, and this one big box is 1 hour. So in fetal heart rate, a heart rate of 120 to 160 beats per minute is considered to be normal. Below 120 is bradycardia and above 160 is tachycardia. Next, coming to the Likert, so we see if the membranes are intact or if it is ruptured, and if it is ruptured we see the color of the amniotic fluid. So the Likert, it can be I, C, M or B. I means the membrane is intact, C is clear amniotic fluid, M is meconium stained, and B stands for blood stained. The next is molding. Molding is nothing but the overlapping of skull bones over the suture lines, and there are various degrees of molding. If there is no molding, we will write 0, that is there is no molding. Molding 1 suggests the sutures are opposed. Second degree molding is when the sutures are overlapped but they are reducible. Third degree is the sutures are overlapped and they are not reducible. These are the various degrees of molding. Then coming to the cervical dilation and descent. The cervical dilation, we start marking from 4 centimeter dilation, that is from the start of the active phase, and then the descent is from 5 to 0, and we mark cervical dilation by X and the descent of head by O. And a normal partograph, the marking should be to the left of the alert line, which means there is normal progress of labor. We can wait till it reaches the action line by proper monitoring, and if it crosses the action line, it means we need immediate attention. We should do immediate intervention by performing C-section. So, left of the alert line is normal. We can wait till the alert and action line. Once it crosses the action line, we should do immediate intervention. Next is the hours. The hours indicate how long the labor is happening, and the time is for recording the actual time. Next is the uterine contractions per 10 minutes. Good uterine contractions, the criteria for that is minimum of 3 uterine contractions per 10 minutes, each lasting for 45 to 55 seconds. These are good uterine contractions. And the uterine contractions, if it is less than 20 seconds, we keep dots. From 20 to 40 seconds, we make stripes, and if it is more than 40 seconds, then we shade the full box. These are the uterine contractions. Then the oxytocin given, if any, is noted here, and the number of drops per minute is also noted, and any other drugs given or IV fluids should be noted in this column, like any antibiotics or any antihypertensives. Now here under this is the pulse rate of the mother, which is monitored every 30 minutes. Next, the blood pressure of the mother, monitored every 4 hours, and these are marked with arrows, whereas the pulse rate is marked with a dot. Next is the temperature of the mother, marked every 2 hours in Celsius. Then we check the urine for any protein, acetone and volume. This is the partogram, which is a very important graphical representation of the second stage of labor. The next thing we do in monitoring the first stage of labor is we monitor the uterine contractions. The time of onset of contraction, the duration of each contraction, and the time when it disappears. So we monitor uterine contractions by placing the palm of hand and feeling the uterine contractions at the fundus. And this is noted at regular intervals. Next, we also monitor the fetal heart rate. The fetal heart rate is checked immediately after a contraction, at least every 30 minutes in the first stage in normal patient, whereas in high risk pregnancy we measure the fetal heart rate every 15 minutes. So we can check for the fetal heart rate using a stethoscope or Doppler ultrasound device. Also we do a vaginal examination once in 4 hours. Then coming to the nutrition, the pregnant women should consume small quantities of liquid nutrition frequently. An analgesia, two types of analgesia can be given, either epidural or parenteral opioids. Based on the condition of the patient. Then amniotomy. Amniotomy can be performed after she gets into active labor. So the benefits of doing amniotomy are, we can perform the labor more rapidly and to detect any meconium stain liquor for early intervention. In such cases we do an amniotomy. Then one important thing is the care of urinary bladder. So always the urinary bladder should be empty for good uterine contractions and cervical dilation. So the distension should be avoided. Distension of bladder to be avoided. So this is all about the management of the first stage of labor. We will see the rest, that is the second stage, third stage and the fourth stage of labor in our next video. Thank you.